It's interesting how this gets used. So if I'm with another part of the federal government and I'm thinking about health disparities or social determinants, or I'm thinking anything regarding health and technology, I would refer to this plan, and I might even adopt some of these plans, some of these aspects as we're developing our goals and guidelines for moving forward. Is that how that works?
Yes. So there's really four ways we focus on working with federal partners and how we would anticipate federal agencies using the plan. The first is to prioritize resources. So the plan is an opportunity for individual federal agencies, whether it's through their budget request or internal planning, to look at what are the priorities that have been established as part of the federal health IT strategy. The second piece, which is a really big part, is around aligning and coordinating efforts. And I mentioned there that we are seeing other agencies, for example, align their strategies to this federal health IT strategic plan. It's also a way for us to coordinate across the federal agencies that are engaged in health IT, which is numerous, and we can coordinate on things like standards. The federal government is actively, working across our partners, and ONC is facilitating that coordination around things like the FHIR standard and how that can be expanded and used for a variety of federal health IT use cases across various agencies. So it's a way, for example, to agencies to come together and align around common standards. It can also be used to signal priorities to the private sector. So while this is a federal plan and speaks to what the federal activities would be, it also can be used as a communication to inform the private sector what are the priorities of the federal agencies. And then the last part is it can also be used as a way to benchmark and assess progress. And so we are focused on, within ONC, and working with our federal partners around 5 cross-cutting areas that we think will help advance overall the goals of the strategic plan. That's, one, as I mentioned, around promoting the use of the FHIR standard across federal organizations. Also, we're looking at using secure standards-based application programming interfaces to provide electronic health information. A third piece, again, another standards piece, is around building off the U.S. Core Data for Interoperability standard that was established in ONC's 21st Century Cures Act final rule, and building off that for additional data classes and elements that support federal use cases. And then the last two pieces are around those data sharing expectations. So deterring information blocking practices using federal authorities and investments, and then encouraging data exchange across networks at both the national and community levels. So those are the things that, as we look forward to implementing the plan, that's what we're anticipating from an ONC standpoint, focusing a lot of our coordination efforts with our federal partners.